The first technique we're going to do is a trigger point release for the subscapularis. You're going to find the axilla, and then what you're going to do is get the client to place their hand over their breast tissue or pec to move it out of the way, and you're going to have the arm abducted like so. You're going to slide your fingertips into that axillary fold area, but you're going to go medially and then kind of curl them to push down slightly posteriorly into the lateral edge of the scapula. You can get the client to do internal rotation to fire the muscle to know that you're on it. It might take a while to sink into this muscle, so you can get the client to take some nice deep breaths in and out. You can bring the arm into more internal rotation to soften it. And once you feel like you're on the trigger points, they may feel pain referral into the posterior shoulder, the scapular region, and the posterior wrist. And you're going to hold the technique for 30 to 90 seconds until a softening occurs and the referral pattern reduces. Something you could do as a nice little assessment is going to be the 90-90 test. Now you can take the arm and have it at 90 degrees of abduction with the elbow at 90 degrees of flexion, and you're going to bring them back into rotation, and you're seeing if there's any kind of bounce back, tension, restriction. You're just really feeling out the area. Now let's assume there is some restriction. The scapulohumeral rhythm is off. I like to do a nice pin and stretch technique that's a combination of active and passive. So I'm sinking in slowly, I'm pinning the muscle down, and as you sink in slowly, you're going to do an active passive where the client's moving, but you're also helping them through the movement. So you're working together. Now, to encourage even more length and relaxation in the muscle, you can resist external and internal rotation for 10 seconds at a time. Get them to take a nice deep breath in and out, and then keep moving the arm back and forth, internal, external rotation, and you're just pinning that muscle down. This is going to help with neuromuscular re-education. It's going to help to retrain the muscle to lengthen through its normal range of motion while you're pinning and stretching, putting it under tension. And it's going to improve glide between the scapula and the ribs. So it's going to encourage that better motion, reducing strain on the rotator cuff tendons. Now hold there. You can resist external and internal rotation a couple of times. And you're really just working to get into that muscle deeper in, so you're really contacting it and retraining the nervous system. One more technique that's going to work really well for reducing tension in the subscap is going to be a strain counterstrain. This is going to be a good technique for anyone with pain in the posterior shoulder region or restricted range of motion, with someone who has also rotator cuff tendonitis or a frozen shoulder. It's a gentle technique. What you're going to do is you're going to place your fingertip down in the tender or trigger point of the subscapularis, wherever there's tension noted by the client. And then you're going to do a little bit of extension and internal rotation. You're going to bring the arm down and back and internally rotate it. And this is going to help to reduce tension. You're going to wait till the client notes 70 to 100% reduction in pain and then release.